I'm Matt Smeltzer. I'm an associate professor of epidemiology at the University of Memphis, and today I have a poster presenting the North American results from the global survey on biomarker testing that the IASLC conducted in 2024. So we presented the global results at the World Conference on Lung Cancer in September, and now we have broken the data out for North America specifically, and we're comparing it with other high-income countries across the globe, as well as low and middle-income countries across the globe. So we had 1,677 total responses to the survey, and from that group, 337 were from North America. And of those, of the total responses, 89% were from high-income countries, and then 11% were from lower middle-income countries. We here are presenting what the individuals from North America said, and we found that 99% of people believe that biomarker testing significantly impacts outcomes for patients, and 94% report that they have a clear understanding of who should be tested. So that was good news. There seems to be a general consensus that we should be doing this. But when we ask, do you think at least half of people with lung cancer in your country get tested? We asked this question in 2018 on the previous survey, and it was only 39% for the world. And we repeated that question in 2024, and it went up to 67% for the world, which was a statistically significant increase. In North America, it was 69%, for about the same as the world number, and then 71% for other high-income countries across the globe. So some improvement, but still we're seeing a lot of individuals who are probably not getting tested. We also ask, do you sometimes or often treat patients without the biomarker testing results? And unfortunately, we found that 40% of respondents in North America say sometimes or often they treat individuals with lung cancer. They initiate treatment before they have the biomarker results. When we broke that response globally, broke it out by income, we found in lower middle income countries, that was true for 73% of respondents. So a big gap there. So we have seen improvements in what people know that they need to do, and some improvements in the perception of testing, but we still have a big barrier for everyone to really get this biomarker testing, which they need in order to ensure that they're getting optimal therapy. We asked our respondents what maybe we should do about it, and so we asked for some solutions, and some of the most frequent solutions suggested were implementing testing protocols, government level intervention, especially around cost and payment, and addressing cost and reimbursement, in general, awareness and education, increasing administration and organizational support, and then access and availability. So there's multiple things that go into testing. First of all, you have to want to do it, and then you have to have the resources to do it. And then if you want to do it and you have the resources, you still have to implement it well. So we have found barriers in all three, but really the want to do it seems to be resolved, like most people want to do it. So the question is, can we provide the resources or help figure out how the resources can be provided? And then if you have the resources, do you have the organizational support that you can do this in an efficient way, get quick turnaround times, and really implement this well in clinical practice? So so the IASLC has launched several initiatives, and you'll be seeing more about that in the coming months to try to improve biomarker testing globally, including some deep dives in some specific institutions to try to find, in some institutions that are doing this really well, try to find out why and how they're doing it, so we can try to spread that and implement that across the world. So I appreciate your attention today, and you can look for the paper to come out soon. We did a number of focus groups and in-depth interviews in preparing for the survey. So this was a mixed methods approach, and we report some of the mixed methods results, some of the qualitative results in the main paper, but we're really going to do a deep dive on that focus group data. That's our next step, and so see what we can mine out of the in-depth conversations that we had, and those were conducted with experts around the world from each different region of the world. And so that's our next step. I think we always hear the cost. People typically list that as the number one barrier for biomarker testing, but we believe that probably in high-income countries anyway, the money is in the system, but it's just not allocated in an efficient way. And so I would like to see more of that, better allocation. And then for low and middle income countries, we really need to figure out how that we can make resources available and affordable and continue to improve technology to make things more affordable and figure out really how to remove those cost barriers.